In today's healthcare, more Americans are realizing the importance of making smarter choices and taking greater control, especially when some level of continuing medical care is involved. But experts say they could always know more.
In general, the public is not completely knowledgeable about all the various aspects of home care and all the different ways that it can serve you throughout your life in the various types of health care that you may need.
And experts say Americans will need to become better educated on their available healthcare options and take proactive, educated steps to secure the type of care they desire.
I talk with people often who either have themselves lived in an institutional setting for a while in their lives or know people who have and their family members. And while it may serve a purpose in certain areas, they always are so thrilled when they're able to receive that same type of support and care in a place that they're comfortable with, where they're surrounded by their loved ones, when they know the surroundings, they know the setting, and they're able to still participate in life and be a part of the community.
We've been married getting close to 50 years of marriage, and my husband's health problems started around maybe in 2000. Gradually, he had a couple minor strokes, and then after that it was a little bit of a decline.
Mrs. Wood's husband ended up having quadruple bypass surgery.
We've always been married a long time. Our children are close around us, and there was just no other thought of him going any other place but home.
Once a patient, patient's family, or caregiver decides upon home health care, the next step is finding the best provider of those services.
If you're going to be needing a nurse, then you definitely want to find a licensed home health agency. They're the only ones that are legally able to provide that type of care in a person's home. Also, we recommend to look for an agency. You may not know it, but if you just hire somebody from off the street or from a referral agency or out of the phone book, you may be, as the consumer, actually responsible for the taxes and the liability and the insurance. You may not even know that you're incurring that liability. But if you hire through an agency, then of course, them as an employer incur all that liability. So we think that is the safe road to take for a person who's looking for home care.
According to Jordan Lindsay, one standout example of the home health care agency in the state of California is Competent Care. Founded by nurses, the agency provides everything from the simplest caregiving services to the most catastrophic. It focuses on a meticulous nurse pre-screening process and on forming strong bonds with the patients they work with.
Competent Care is a licensed home health agency that was started in 1988 by myself and 3 other registered nurses. And we saw the need for a quality home health agency at that time. We had all been working for several agencies in the area, and we felt that there was just a level of care that was just not out there that we thought we could provide.
I've always seen home health as an extension of the client's family. You cannot go into a home, take care of a person, mix and mingle with their family members, maybe their children, their spouse, their parents, whatever it may be, and not become part of that family.
Good morning.
Hi, how are you?
I'm doing fine. How are you?
I'm here to conduct the supervisory visit today.
They just blend in like another family member, but taking care of business. And I work every day, so I have to leave the home when they arrive. It gives me so much comfort to know that I can walk out of the door and do the job that I have to do. And I have people here who are competent, and I'm sure that they're taking care of my husband and giving him the best care.
We like to make the right match. We think that it's very important to find out what specific requests or likes or dislikes that the clients have for someone coming into their home, and then we try to match them with the nurse that would be most appropriate to them.
There's 24-hour calls I can make no matter what day or time. Somebody is right there and on the phone to assist me with anything that I need. That is really very comforting because, you know, usually things close down on the weekend and at night, but there's someone always there.
I've been with Competent Care since 1990. It's 19 years. And I'm not the only nurse who's been with Competent Care for that long. We have many nurses who've been many, many years with Competent Care and plan on staying with us for the remainder of their career. We love that not only our nurses, our employees, our caregivers stay with us for a long time, but so do our clients.
I forget to take care of myself because I'm so into assuring that he's taken care of. Knowing that it's not the right thing, being a nurse myself, but these nurses from Competent Care really have the whole picture put together.
Competent Care is one of many home health agencies in the mid to southern California area, and we service a multitude of patients from pediatric to geriatric. And this is very typical of home health agencies in the Southern California area. And what we strive to do is provide that care in just a little bit more of a homey atmosphere. The fact that our agency was started by nurses and is still today run by registered nurses, we feel that we can offer that level of nursing professionalism that many of the other agencies who are run by business people just don't have.
As a state association, what you hope to find is that your members, the ones that you represent, are involved in the process. And that's what we have found with Competent Care. That's why we're so happy to have them one of our members and to be able to partner with them on so many issues. They're not only involved at the state level, whether it's going to the Capitol with us, we need them to educate the legislators on the importance of home care. They're also involved with us at the national level. They go with us to Washington, D.C. to educate the policymakers at that level. And we only hear great things about Competent Care and the people that they serve and the services that they support.
What we've noticed during the course of the 21 years that we've provided care is that the patient's health, well-being, and healing has actually improved by going home. It's something that we need to think about the same as we used to think about going into a hospital for. You go into the hospital no matter what age you are, infant to old age, and the same thought processes really need to be given to home care.
So it's all of our responsibility to learn what options are out there, and I think that home care is the best solution.
Americans need to be more prepared to make important decisions if a long-term medical need arises. Whether it's simple companion care or care for a catastrophic illness, more and more patients and their families are choosing to bring nursing experts into their homes and taking greater control of their health care. That's why more and more people are choosing Competent Care Home Health Nursing, licensed and insured, owned and operated by registered nurses. Our mission is to provide the most professional and comprehensive home health care services and quality of life through dedicated nursing efforts. We provide a wide range of services and treatment programs to meet the most basic to the most complex medical home health care needs, when only the best care and the best nurses will do. Choose Competent Care. For more information, call 800-755-4818 or visit competentcare.com.